Welcome to Lesson 4 CPR First Aid with Abhishan. Today we're going to go over breathing problems and choking. Breathing problems. So, what are breathing problems? Someone may develop mild or severe blockage of the air passages. Someone having a heart attack, having a stroke, or experiencing any certain injuries may also have breathing problems. And how can you identify when someone is having a breathing problem? So, someone breathing very fast, this is known as hyperventilation, it's a sign of when someone's having a breathing problem. Them exerting effort with every breath, noisy breathing, and if they can only make a few sounds or speak a few words before stopping, are all signs of when someone is having a breathing problem. So, inhalers. Many people with medical conditions such as asthma know about their conditions and carry an inhaler medicine that can make them feel better within minutes of using it, and you may need to help them use it. So, at home, you can find one fact about asthma. Well, asthma is a long-term lung disease that inflames and narrows the airways. It causes recurring periods of wheezing, so a whistling sound when someone breathes, and it causes chest tightness, shortness of breath, and coughing as well. The coughing often occurs at night or early in the morning, and about 23 million people in the United States are known to have asthma. So, using an inhaler is made up of two parts, the medicine chamber and the mouthpiece. And why do you need to know this? When someone is having trouble breathing, he or she may panic. So, for this reason, you should be ready to assemble the inhaler and help them use it. So, here's a diagram of the inhaler. You can see the medicine canister, the mouthpiece, and the spacer as well. So, using an inhaler, you have to shake the medicine, put the medicine in the medicine chamber, remove the cap from the mouthpiece, attach a spacer if there's one and you know how to, tilt the person's head back slightly and have them breathe out slowly, put the inhaler or spacer in the person's mouth, push down on the top of the medicine canister, have the person breathe in slowly and deeply as you push down, have the person hold his breath for 10 seconds and breathe out slowly. How to help someone with breathing problems. So this is, like I said, anyone with asthma know about their conditions and carry inhaler medicine that can make them feel better within minutes of using it. And helping someone with breathing problems. So first of all, we always make sure the scene is safe. Ask them to get their medicine. If they need help getting the medicine but is too sick to get it themselves, get it for them. Ask the person if you have the right medicine. Assemble and use an inhaler. Call emergency services. Stay with the person until someone with more advanced training arrives, and if the person needs CPR, give CPR. Now let's move on to choking. What is choking and when does it happen? Choking is when food or another object gets stuck in the airway in the throat. The object stops air from getting to the lungs, and some choking is mild and some is severe. If it's severe, you must act fast. Get the object out so the person can breathe. Now, find one fact about choking. Choking is the leading cause of home injury death in the US, and adults are at an increased risk of choking due to dental problems and age-related illnesses. Other causes of choking include eating too fast, talking with food in the mouth, and wearing dentures, or eating foods with the wrong texture. Mild versus severe choking. What are the symptoms of choking? Inability to talk, coughing, and fainting. What are the signs of mild choking? Can cough loudly, can make sounds. What should you do to help? Stand by them and let them cough, and if you're worried about their breathing, call 911. So here's a little table. What are the signs of severe choking? Cannot breathe, has a cough that has no sound, cannot talk or make sound, and makes this choking sign. So what should you do to help? Act quickly and follow steps to help a choking adult. The table. And here is a universal choking sign. It is when people are holding the neck with one or both of their hands, so they're clutching their neck. Now, how to help a choking adult. How do you think you can help a choking adult? The Heimlich maneuver. So when someone has severe choking, give thrusts slightly above the belly button. These thrusts are sometimes called the Heimlich maneuver. Like a cough, each thrust pushes air from the lungs, and this can help remove an object that is blocking the airway. The Heimlich maneuver. So here's step 1. If you think someone is choking, ask them, are you choking? If they nod yes, tell them that you're going to help. Get behind them, wrap your arms around them so your hands are in front, make a fist with one hand, and put the thumb side of that fist below their belly button, so below the navel, and well below the breastbone. Now grab the fist with your other hand, so with maybe even a flat palm, and give quick upward thrust into their abdomen. So you just cover that other fist. Now give thrust until the object is forced out and they can breathe, cough, or talk, or until he stops responding. Now find one fact about the Heimlich maneuver. How can you help a choking pregnant woman? To help a choking large person or a pregnant woman. So if someone is choking and they're in the late stage of pregnancy or is very large and you can't wrap your arms fully around the waist, you must give thrust on the chest instead of thrust on the abdomen. So follow the same steps, except where here the location is different, where you place your arms and hands. So put your arms under the armpits and your hands on the lower half of the breastbone. Pull straight back to give the chest thrust. So here's a diagram on how to give chest thrust on a large person or a pregnant woman. How to help an adult that is not responding. If they need CPR, you must give CPR. If you don't know how to give CPR, give hands-only CPR. Continue CPR until they move, speak, or breathe, or when someone with more advanced training arrives and takes over. Choking infant. Choking is very common in small children and is caused by swallowing huge chunks of food. Some of the common objects children tend to choke on are buttons, carrots, toys. Symptoms of choking in children include high-pitched breathing, coughing, color changes, and lack of breathing. How to help a choking infant. Choking in infants is treated using back slaps and chest thrusts. To administer the back slaps, the baby is supported using one hand facing down. The back slaps are administered using the heel of the hand. The chest thrusts are applied using 2 fingers just below the nipple line. So you must cycle these with 5 chest thrusts and 5 back slaps. And it's a total of 5 cycles. And if the object is not dislodged, so it doesn't come out, continue doing more cycles. Here's a video.
It would be very easy for you to...
Now we're going to review and do a scenario. You are having dinner in a very crowded restaurant with your family on New Year's Eve. An older man is pushing a piano into the restaurant as part of the entertainment that evening. As he passes your table, he clutches his chest and falls to the floor. He is not moving. So what should you do? If he's not breathing or breathing abnormally, you should call 911, yes or no. These are all yes or no questions, so you can look over it. And here are the answers. So if he's not breathing or is breathing normally, you should obviously call 911. The man must be choking, but because he's in the restaurant, not necessarily. If the man is choking, you should perform abdominal thrust. This again, not necessarily, because it depends. If the man is choking, you should perform 30 sets of chest compression in 2 breaths. And this is only because they are unresponsive and not breathing. Check for breathing before giving any breath to the person, yes, and continue CPR until an AED becomes available or emergency service personnel arrive. Now that is the end of today's lesson, and let's meet back in lesson 5.